In this PowerPoint, we will be discussing implementing crisis and emergency protocols. This is task list item D6. This training program is based on the RBT task list and is designed to meet the 40-hour training requirement for RBT certification. The program is offered independent of the BACB. In this PowerPoint, we will cover the following topics. First, we will start by discussing an introduction to emergency and crisis procedures. This will lead us into discussing the different types of trainings that you may be asked to complete while working as an RBT for companies. Our final section will cover other considerations for safety, such as how to respond in medical emergencies and follow protocols. We also will provide a list of the resources we use to create this video. Every center should have a plan for how to deal with emergency and crisis situations. There should be general procedures to follow, as well as client-specific procedures if necessary. To understand how to implement these procedures, your BCBA or other supervisor should train you on how to implement certain protocols. You should have an opportunity to review the protocols and practice them if necessary. It is important to take these trainings as an opportunity to ask questions and ask for clarification, as emergency situations often require immediate responding. So it is important that you have a good and thorough understanding of how you should react in these situations. As an RBT, you may be required to complete some formal trainings, such as first aid, CPR, CPI, safety care, and/or manned training. As mentioned previously, you should have a thorough understanding of the center and child-specific protocols. When receiving certification through the programs listed above, it is crucial that you pay attention, take notes, and ask your BCBA or trainer any questions that you may be uncertain about. Additionally, you should always have an emergency contact accessible. You should have your supervisor's phone number as well as the contact information of a guardian, caregiver, etc. that is responsible for taking care of your client. Having this information allows you to quickly communicate and debrief all necessary individuals about any crisis or emergency situation that has occurred. We will now go over some common training programs that you may have to complete to work as an RBT. Crisis Prevention Institute, also known as CPI training, teaches prevention and managing of crisis and emergency situations with clients. This training covers working with a wide variety of clients, including working with individuals who are verbal or nonverbal. Having this wide variety allows the trainee to apply the knowledge they learn through CPI to several different individuals. This training also teaches self-management techniques to prevent appearing nervous or fearful during situations. As a professional, you want to ensure that you are de-escalating dangerous situations. Therefore, it is important that you remain calm and prevent your emotions from showing and potentially making the situation even more dangerous. Because of this, CPI trains individuals on how to prevent emergency situations, how to respond to and de-escalate emergency situations, and how to manage your own behavior throughout the process. Cardiopulmonary resuscitation, or CPR certification, focuses on teaching individuals how to respond to cardiac or breathing emergencies. This certification typically includes learning about how to use chest compressions and mouth-to-mouth breathing techniques to increase blood flow and breathing. This training will teach you how often to do chest compressions, how to tell if these procedures are necessary for your client given the emergency situation that they are in, and how to communicate what is occurring with those around you and medical professionals. Safety Care Behavioral Safety Training is a 12 to 16-hour training that teaches participants to respond to aggressive behaviors. The techniques used in this training are based off of evidence-based ABA approaches. They use these approaches to train individuals on how to prevent and respond to clients when they become aggressive or violent. It also teaches techniques on how we can increase replacement behaviors for these aggressive or violent behaviors. This program emphasizes using positive reinforcement with clients to prevent dangerous situations and alter behavior. Some prevention techniques taught include learning to have positive and supportive interactions with clients, which may decrease the probability of them engaging in dangerous or aggressive acts. This training covers a wide variety of possible clients, including high versus low functioning clients, and clients who have and do not have communication skills. As mentioned previously, this training covers a wide variety of topics, including preventing crises from occurring in the first place. This may involve setting up the environment to ensure safety. You would want to remove dangerous objects such as knives, scissors, or other items that could be used to harm others or the client themselves. Additionally, you would want to wear clothes that ensure safety. This typically involves avoiding loose clothing or jewelry and accessories that could lead to injury. Finally, they also discuss detecting possible antecedents and precursor behaviors that could be a sign of problem behavior occurring soon. Safety Care Behavioral Safety Training also covers topics related to methods of how to deal with current crises, such as physical safety skills and dealing with weapons or other dangerous objects that a client may get a hold of. It also teaches you on what to do when the crisis ends, such as recovery procedures and how to discuss the incident with staff, caregivers, or other necessary individuals. The final training we will discuss is MANT training. This training focuses on preventing and dealing with emergency situations in which an individual's behavior is dangerous. This training covers ensuring safety among several individuals, including maintaining a safe environment between employees and a safe environment between an employee and their client and the client's family. It focuses on building healthy relationships between staff members, as this increases the likelihood that staff will support one another and support a healthy and safe work environment. Staff members being able to trust one another can lead to more appropriate methods of dealing with frustration and anger rather than violent methods. It also teaches the trainee how to build relationships with clients and their families. Alike to the staff example, building rapport and trust between a professional and their clients can increase the likelihood of an individual engaging in appropriate behaviors whenever responding to a stressful situation rather than dangerous or violent behaviors. The main takeaways from MANT training is for the learner to know how to build healthy relationships with others and have good communication and conflict resolution skills. By doing this, the professional should be able to avoid using intrusive techniques such as restraint. It also provides training on how to implement positive behavior support plans. This method is based in ABA and is used to alter the client's behavior. Finally, it educates learners about the effects of childhood trauma and how it can have an impact on current behavior. Focusing on the client's behavioral history and experiences may give more insight as to how current behaviors started occurring and what may be maintaining those behaviors. Now we will discuss other considerations for safety while working with your clients. To prevent a client from becoming injured, we must ensure that our environment is set up to be safe. For example, if a client has a history of harming themselves with specific objects, you should remove those objects from the environment. Additionally, if you are working with a client who tends to put small objects in their mouth, You should also remove small objects from the environment to prevent choking. If your client has precursor behaviors, you should intervene as soon as possible to prevent further escalation of behavior. An example of a precursor behavior could be a client who paces back and forth right before they engage in property destruction. By intervening at the point where they are pacing back and forth, you can prevent a dangerous behavior from occurring. It also is crucial that you always keep your client in eyesight. You should never leave your client alone in a room, especially a client who engages in violent or self-harming behaviors. If injury does occur, or if the client appears to be ill, you should inform the appropriate staff and follow any emergency protocol that the client or company has in place. It is important to avoid coming into physical contact with a client's blood or other bodily fluids. If the client is bleeding or does have other bodily fluids on them, you should use gloves and avoid touching the wound or blood directly. While doing so, staff should be informed that bodily fluids are present. If you do happen to come into direct physical contact with the client's blood or other bodily fluid, you should wash that area with soap and water immediately. Inform staff or your supervisor about the contact and seek medical assistance to ensure you have not contracted any diseases, illnesses, and so on. Some clients that you work with may experience seizure-related disorders. The Mayo Clinic defines seizures as a sudden, uncontrolled electrical disturbance in the brain. This disturbance can cause changes in behavior, movements, or feelings, as well as a change in the levels of consciousness. Common symptoms that a client may exhibit if they are having a seizure include temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, and cognitive or emotional symptoms such as fear, anxiety, or deja vu. It is important to note that not everyone's seizures will look exactly the same. If the client has a history of having seizures, talk to their caregivers or other medical professional to understand what their seizures typically look like. Additionally, you should follow protocols as written to respond to client seizures. The following is a question that you should write down in your homework packet. You are working with a new client who has a history of seizures. What should you do to ensure you are prepared to respond to a seizure if your client has one? Select all that apply. A. Discuss what seizures look like with the parents or caregivers. B. Review the client's seizure protocol. C. Wait until the seizure occurs and call your BCBA over. Or D. Search internet for seizure and find out what to do there. I'll give you guys a moment to review these answers and determine which ones you think are right. The correct answers are A and B. You should discuss with the parents or caregivers or your BCBA if they have gained that information already about what the seizures look like and what the caregivers would like you to do if a seizure occurs. You should also review seizure protocol for your client before working with them. This is a document that your BCBA should have made that tells you what to do if a seizure does occur. While ABA is often associated with children who have autism, it is important to remember that you can work with a variety of populations, including adults. With these populations, you may experience medical emergencies such as a client having a heart attack. A heart attack is a result of blood flow to the heart being blocked. There are a variety of symptoms that you should look out for if you think your client may be having a heart attack. Alike to our last topic, these symptoms can vary. Pressure, tightness, pain, or squeezing sensation in the chest or arms that often spreads to the neck, jaw, or back. Nausea, indigestion, heartburn, or abdominal pain. shortness of breath, cold sweat, fatigue, lightheadedness, and so on. Because symptoms may vary, it is important to always be safe rather than sorry. Therefore, you should call 911 immediately if you believe that your client may be suffering from a heart attack. Another emergency that you may experience if working with adults is strokes. Stroke.org provided a list of symptoms that they refer to as FAST. F stands for face drooping or numbness, A stands for arm weakness or numbness, S stands for slurred or inability to speak, and T stands for the time to call 911. They emphasize the word fast because it is critical that you call 911 as soon as possible after recognizing that your client may be having a stroke. This will help emergency services in providing treatment as soon as possible. Other symptoms that the client may experience include numbness on any part of the body or their entire side of their body, sudden confusion or trouble seeing, sudden trouble walking, and sudden severe headache. Alike to the FAST example, if you see these symptoms within your client, make sure to seek medical services immediately by calling 911. The following is another question that you should write down in your homework packet. You should only call 911 for a suspected heart attack if your client is exhibiting 3 of the previously listed symptoms. A, true, or B, false. I'll give you guys a moment to review these answers. The correct answer is B, false. If you suspect a medical emergency is happening, you should always call 911. The client can be exhibiting 1 symptom or several symptoms. Regardless of how many symptoms are being exhibited, it is very important to seek medical services immediately. As for technicians, it is also important to take measures of safety when dealing with illnesses or injuries. It is especially important to follow protocols for contagious illnesses. If you have an illness, such as pink eye, that can be contagious, make sure to take the appropriate measures before returning to work. You should not return to work until the illness is no longer contagious and no longer prevents you from providing adequate services. As for injuries, if you become injured while working, you should inform someone immediately. You will have to fill out an incident report so that the company has a record of what day the injury occurred, what was happening before, during, and after the injury, and if you sought medical services or leave from work following the injury. This should be done for minor injuries and major injuries. If the client engages in self-injurious behaviors, you should always follow their behavior protocol to ensure safety. The behavior protocol is likely to include information regarding preventing and responding to SIB. If your client engages in SIB but does not have a formal behavior protocol, you should ask your BCBA for one. Having this in writing ensures that everyone is on the same page and knows exactly what to do in a situation where SIB occurs. Unless otherwise specified, you should block the behavior from occurring. For example, if a client was headbanging, you could add padded mats to areas where the client frequently engages in the headbanging behavior. Additionally, you could also rearrange the environment to prevent headbanging. For example, if the child headbangs frequently when their seat is placed next to the wall, you could rearrange the environment so that their seat is not directly next to the wall. We want to ensure our client's safety. Therefore, it is crucial that we prevent SIB from causing injury to our clients. As an RBT, you must be aware of your obligation to report suspected child abuse or neglect. You must be familiar with the laws that correspond with the state in which you are practicing as an RBT. If you have reason to believe neglect or abuse is occurring, you must report it to either the police or Child Protective Services. This will depend on what state you are in and what the laws require. If you are unsure if what you saw or heard is abuse, talk to your BCBA immediately. They can help you sort out the situation and move forward. Additionally, you should discuss the matter with them so they can assist you throughout the reporting process. You should remember that you are only responsible for reporting the incident. You are not responsible for investigating it. This means that you should not be trying to gather additional evidence or interview people. Instead, you should gather any evidence that you already have that shows abuse or neglect has occurred and report it. AutismSafety.org defines restraint as any manual method, physical or mechanical device, material, or equipment that immobilizes or reduces the ability of an individual. For example, using straps to keep a client confined to a chair or table, or wrapping your legs and arms around a client to prevent them from moving, and so on. You should never use restraint unless you have received formal training and certification to do so. This helps ensure that you are using restraints in a safe manner that will not harm the client or yourself. Despite trainings being available, you should still always try to avoid using restraint. This is a very restrictive method that should only be used in situations where it is absolutely necessary. In addition to restraint, you should also avoid physically carrying or supporting the weight of your client. This is also restrictive and can put the client in a dangerous situation if you were to accidentally drop them or trip over something. The following is a question that you should write down in your homework packet. You should only report child neglect or abuse if you see it occur firsthand. A, true, or B, false. I'll give you guys a moment to review the question and answers to determine which one is correct. The correct answer is B, false. You should discuss any concern you have of neglect or abuse with your BCBA. They can help you determine if you should or should not report it. Some times where you may have concern of abuse or neglect include a client who is underweight and always appears hungry when they come to sessions, a client who has several bruises or other marks on their body weekly, or a client who verbally tells you that they are being abused. In any of these above situations, you should report the incident to your BCBA and determine what to do next.